Next one here is from Bonnie. She says, I've been an A4 clinical trial participant. So this is the use of an antibody to amyloid. And these, of course, haven't shown any benefit in terms of clinical changes yet, as I showed at the very beginning. But they keep pushing it earlier. Well, again, when you recognize that this is actually all about addressing insults, you realize that you want to address the insults, not just get rid of the amyloid. I think in the long run, getting rid of the amyloid after you've gotten rid of all the things pushing it is going to be a good idea. But in this case, Bonnie has been on the A4 clinical trial for 7 years, 2.5 years in the open label phase, spent this week listening to AAIC presentations online. So this is the ongoing Alzheimer's Association, which is, so all of the supporters are drug companies. And so unfortunately, no positive results to report in terms of reversing cognitive decline. She's saying, how does ReCODE compare or contrast to the many trials of modifiable risk factors? So a couple of ways. Of course, the modifiable risk factors you were just hearing about from Julie, but what we're doing, the basis of ReCODE is to ask what's driving the decline. We're not just saying, let's just start exercising someone. We're saying, what's causing your decline? And let me give you an example from Julie herself. As she has written about in the first survivors of Alzheimer's, written about beautifully, she had this tremendous improvement. And then after several years, she actually had a little bit of a slide. And so we wanted to look at what is driving that. And I know, Julie, you saw a few doctors who didn't find the problem, but clearly something was driving that change. And ultimately, it turned out to be babesia, as she documented beautifully in the book. And she went to see Dr. Schweig, who's an expert in tick-borne illnesses and who's done a tremendous job for her. So that's the difference between just doing, quote, modifiable risk factors, where you're assuming, okay, if we do these things, maybe things will be okay, and saying, we're going to get to the bottom of what actually is driving your decline, and we're going to target those things. That is what has given the best and most sustainable results to date.